Thanks for joining me here at Contour Image, where I help you find and embrace your true beauty. And today we are going to be talking about fillers. Now, just about a week or so ago, I just did a video over Botox. And so now we're going to be talking about fillers. And while some people may not really understand the difference between the two, so Botox actually freezes the muscles in your face so that you don't contract and make wrinkles, while the filler actually fills in any lines and wrinkled areas that you already have so that you don't see them. So we're gonna go over a few videos that I found on TikTok to just describe a little bit about it and the whole gamut, kind of similar to what I did for the Botox video that I talked about earlier.
All the places you can place filler: temples, tear trough, piriform, cheeks, smile lines, jowl support, chin, DAO, jawline, and lips.
To anyone that needs to hear this, this is one full syringe of cheek filler. And this is a full syringe of lip filler. So this one's for cheeks. As you can see, as I squish it, it holds up its structure. This one is more for areas like the lips with high movement. It does not hold up the structure as well. You can see it on my glove. And it breaks down a little bit easier so that it looks more natural. Whereas this, we want to mimic bone, and it looks a little bit more gritty, grainy, but it holds the structure beautifully. Both are equivalent to 1 ml, but this is why your injector chooses different ones for different areas, because they will behave differently. Have any more questions about filler? Comment below.
That's good to know. So now we're gonna see some great results. I completely understand why people will use filler for specific reasons. You will notice that they tend to use it for obviously not just beautiful reasons, beautifying reasons, or anti-wrinkle, but it's also for a lot of other areas and what they do for the skin. So even though I mentioned it was for like lines and wrinkles, while that is true, they're actually considering using it for other various reasons for beauty. So we're gonna see some really good results actually with the filler.
If you want to know what 8 mLs of filler looks like, keep watching. I'm an aesthetic physician assistant and I share all things anti-aging and beauty. Follow me for more. The areas of focus were temples, tear troughs, mid-face, lips, and chin. Adding volume to her under eyes and cheeks is going to restore a natural V shape, giving her a more rested and youthful look. Adding lip and chin filler is really important for this patient's overall facial balance. We're going to improve the overall facial shadowing as well as improve her side profile. This is the patient's final result. This was done over 2 visits, and we did neurotoxins as well to improve the fine lines and wrinkles on her upper face.
Facial reshaping with fillers includes strategically placing filler in structural areas like the mid-face and cheek area, as well as helped her under eyes indirectly. I also injected a little bit of Restylane directly under the eyes, and overall her facial structure is more balanced.
My favorite treatments to perform is profile balancing. Some patients feel that their nose is too big for their face, but it has more to do with the fact that the chin is too small or set back. By adding filler to the chin or using a chin implant, we can bring the chin forward so that it's better aligned with the nose. These little changes in the nose and the chin can make a big difference in the profile.
This patient wanted a little bit more of a heart shape. She also felt like her lower face was heavy. So we added filler to her cheeks, nasolabial folds, chin. There is some swelling present here, but she'll be all healed up in 2 weeks.
I can see why people do it. It's not just for putting in the lines, it's also reshaping your profile so that you look more balanced. Because what makes beauty is balance. It's balance. It's ratio balance. It's the golden ratio. That is something that they have come to understand and know in theory that that is kind of what we as human beings tend to be attracted to and think and call beautiful. Now, even some things that aren't necessarily symmetrical can still be very beautiful. And we're not all made perfect. So there are some things that are off, but you know, that's part of what my channel is about how to create symmetry, how to do that, and how to create that beauty from what you already have. And I'm not someone who is suggesting, hey, you should just do filler and Botox and all that. I'm actually kind of against it, actually. And it's because I just feel like there are other more natural approaches, and just another way of eventually kind of falling in love with yourself for how you were made in a healthy sense. We all have things we don't like about ourselves, and some people might have a little bit more beneficial, a little bit more, if you will, blessed with a specific look that seems to be portrayed as more beautiful than others. But that doesn't mean that you're not beautiful if you don't come across those people. I think as women and as girls, especially when we're very young, at a young age, we tend to compare ourselves to our friend or a girl at school, or now, you know, social media now, and commercials and movies and all that stuff, where I think people are like really, you know, they do that and they go, oh, I wish I had hair like that. Oh, I wish I was, you know, with this and that. And I noticed that definitely with me as being much younger. But I have grown to just accept some things. Like, you know, back in my day, curly hair was not really a thing that was in. Straightening it was the thing, because it was almost like they didn't understand curly hair very well. And so all the products and things were always for people with straight or straighter hair. So doing curly hair was always very difficult. So straightening the hair was always much easier to manage because that was what was expected. But we really, you know, curls tend to also nowadays become something that's more feminine and beautiful, that now some women are like, oh, I wish I had curly hair. I have to go and get a perm to get that or something. You know, there's always someone that thinks whatever you have is beautiful. And you might think, I don't like it. I don't think it's pretty. I think, you know, what she has is pretty, or whatever. You always want something that you don't. So how about we find a way to make it so that you really do accept yourself and find yourself beautiful, you know? And let me tell you, when you feel that way, you shine from within out and radiate, and people see it and they think, wow, she's so beautiful. Like, I know that happens. It happens. That's how people start liking other people. They want to be around them. They want to be friends with them. You know, maybe even romantically, whatever it may be. That's just how it works. So in this channel, I'm trying to create that and trying to make that. If you want to, you know, subscribe to my channel, follow along with what I do and promote, over the time you'll start to see the development of how everything will work for you and for this channel, that you'll notice how it grows. Now this next video that I have, it just hit a little bit of a nerve for me, because I'm gonna play it off and then I'm just going to discuss it real quickly.
I'm going to use Sculptor, and we're going to place Sculptor in her mid-face. You can see she's very flat in presentation right here. So I'm going to use a cannula. Cannula, again, is a blunted tool that will allow me to enter in her face without bruising her. Also, it just makes it a whole lot safer. I'm also going to give her a bit of volume in the scalp itself, and you'll see it almost acts like a nice little ponytail lift to kind of lift up everything and harmonize, and it'll be quite gorgeous.
Honestly, I didn't even really, it wasn't an extreme difference. Now, yes, there is a difference. This woman, this practitioner, she knows her stuff. I'm gonna say that. And I think she goes into the profession because it's exciting. She likes doing this. And I think she does want to make women feel beautiful and be beautiful. I really do. The only thing that I'm saying, though, is she kind of mentioned, you know, she looked kind of flat here. And I understand that because a lot of them will be talking about the profile again, I think later in these videos. But I'm just like, how many of you, and I'm curious to know in the comments below, how many of you have ever gone to a practitioner, maybe anyone, maybe you've gotten filler before or Botox or anything like that, and they mentioned something that you didn't notice, and you're like, what? Now you're becoming more subconscious, and now you're willing to do something that you wouldn't normally have done anyway, and that you didn't go in for that. That's kind of an interesting thing. Now, as an esthetician, there are times I would look at someone's skin and they'd say, oh, I have this problem, I want to get rid of this or do that, and blah, blah, blah. And I'll go through it, and then I'll be like, oh, what about this here too? I mean, we see things, we know things, we know what we want to see, and what, in my example, what the skin should look like. You know, if this was gone or softened up, Wouldn't it be better? The thing is I was not selling or doing any products that were horribly, horribly, horribly expensive. A lot of things can be done, especially nowadays at home. Not everything, but you know, I talked about red light therapy in one of my earlier videos. You can buy a red light therapy panel. I think even in my Botox one, they talked about that a little bit. Someone just briefly mentioned it quickly. You can use those things to help, you know, get your skin glowing and keeping yourself youthful and everything. You don't have to necessarily go to an office so long as you purchase a quality machine, for example. So if I've ever made anyone feel a little bit less, it wasn't because I was trying to make more money or that I was trying to make them feel self-conscious or anything like that. It was really just like, hey, no, your skin should actually be looking like this. Let me show you. Let me explain it to you. And I would maybe do something and it would help a little bit. The thing about skincare is it's a consistent use of good products day and night. Like if you're not willing to really like even wash your face properly and use the proper products, nothing I do is going to work for you. And same with a lot of these other surgeries. If you're not going to do something, it's not going to work for you. So because the skin needs certain things to keep itself youthful. And there's a whole science behind it. And I have explained a few in other videos as to what that is. And then I also have information that I have on my website that you can take a look at. I will put that in the link down below for you to kind of look over. But anyways, on to the next videos that we're going to do here. Now, this next part is going to talk a little bit about kind of the side effects or just the problematics of doing filler. This one I think is particularly more towards the lip, but it might go on further than that. So let's just keep watching.
Let's talk about lip filler migration and why it happens. So this occurs when filler is placed above or below sphincter muscles and our body naturally moves the filler over time. This can be treated, but you need to make sure you're not getting too much filler and go to the right injection.
Yeah, it just kind of cut her off again there, but that is something that, you know, what can happen is kind of like what I mentioned in the Botox video. If you haven't watched that, I suggest you go and take a look at that one. But it can migrate, or in the Botox one, it was talking about leaking, where sometimes, in this case, it wasn't necessarily, I don't know if it was necessarily a leak. You place Botox or filler in certain places or whatever, and it just might move a little bit somewhere, and now you've got a weird spot. And like in this case, a lot of times it happened a lot in the lip area, because we use that a lot while we eat, drink, talk, and everything. And over time, it can kind of wear out. And as you saw earlier in the video, there's more or less two different kinds of stability in the filler stuff. The lesser one is made for the lips, while the harder, more dense are for like cheekbones and things like that. Now, this next video I decided to place in because it was something that I kind of noticed. I do believe she's a beautiful woman. I do. So before anyone says that I'm saying anything, no, that's not where we're going at this. I just want to say that she's a beautiful woman. I just feel like, and I think we've noticed this more and more, and another woman's going to kind of talk about it. I want to show like what happens a little bit with a kind of a disformed facial structure over time when you're using too much filler or Botox or any of those. We talked about in my other video, Botox can make, I can never say the word, it's such a weird word, but it's atrophy in the muscles. So now you're not really using the right muscles and they're shrinking and getting smaller while you use other muscles that get bigger next. But then you have filler, where you're filling spots to give, a lot of them give like higher cheekbones and things like that. And I think this girl's just gone a little too far. It's my opinion. And I know people are gonna say, well, whatever she feels makes her feel beautiful. I just want people to be more aware of what can happen if you just overdo it. And like I said, I think she's a beautiful woman, but I just feel like she's a little poofy. And we'll see that here. Yeah, so, okay, so it is saying something. I might have to read it. It's kind of hard to read where I'm at, so I might have to zoom in a little here for myself. I guess she went in, I don't know, I guess she went in for a droopy eyelid. Okay, ptosis, okay, occurs when Botox diffuses to the muscles, controlling the eyelids, weakening them. The ptosis injection techniques and proper placement can minimize the risk. And so real quickly before I finish reading or whatever, like she's talking, I guess she was really doing something about the eyelids here. But the reason I put this one in is, like I said, I just want you to see, I can tell that those are not her cheekbones. Overuse of incorrect placement of Botox can lead to excessive weakening of the muscle, resulting in atrophy. So I just kind of discussed that earlier about how that can happen. And so now she's trying to correct something that, you know, she probably didn't even realize could even happen. She's been told that Botox is a great wonder drug or whatever, and now she's going to do it. And then it just, no one ever tells you. Like, I feel like some of these people should also be teaching about skincare. I really do. I mean, it's about preventative and anti-aging. Skincare is a huge deal. That's your first step, really. The biggest spot right now that had happened just a few months ago, I think, maybe a year, I don't even know if it's been a year, but it might have been, was Kylie Jenner. She got a big tiff about filler at one of the events that she went to. And because they were noticing, not just about filler, but it was actually like Botox and filler, and they were noticing like how her face, like the lighting hit her just so that people were noticing like, oh my gosh, she looks older than she really is. What is going on? And people kind of started to freak out a bit. And I just wanted to show that because that can happen. And yeah, she looks much older than she really is because she used this stuff at such a young age, to be like all her sisters and whomever else. She, you know, because they were using it, and she was like, what? She was the youngest. I don't really know much about the Kardashians. I really don't follow them. I never looked at them or anything. But I just know when this came out, it was the biggest deal. And I kind of feel bad for her because she got trashed over it, you know. But that's what happens when you're a figure in Hollywood. People are going to love you. People are going to hate you. It's just the thing of it. But what people noticed on this was what filler was starting to do. And I just feel like that ultimately opened the door to make other women wonder, is that what's happening to me? And I think it just opened that can of worms.
Hi, it's Dr. Jen, and welcome back to Celebrity Review. So today we pulled Kylie Jenner's picture, and we didn't do the famous one of her being 13 years old because it's just too drastic. So this before picture, she's already had work done. Okay, you guys, there's a lot going on here. Even though she's already had work done here, look at this drastic difference. Like, there's too many yes people in Kylie's life. Like, we need some no people here.
One of the things I also noticed about her skin there that she took up that picture, she almost looks like those brothers. I forgot what their names are, but I'll put a picture here for you. But that picture of her, she's kind of starting to look like these twin brothers that are very well known. And I see a very similar thing happening because we're always putting in filler in specific areas of our skin all the time, but it's very common, primarily like cheekbone, for example, but then you've seen other places that we can start having issues. So I'm just going to put this video in right here at what this girl is talking about to kind of explain more about it.
I'm going to say this once. Fillers are to make 50-year-olds look 40. Fillers are to make 40-year-olds look 30. Fillers are to make 60-year-olds look 50. If you are in your 20s or teens putting fillers in, they are going to make you look 30 or 40 or 50 because it's the reverse effect. It's to make you look younger if you have a bunch of loose skin, but you don't have a bunch of loose skin. So now you look older. Fillers are to fill what has been lost. If nothing has been lost and you just want to fill, you will look the reversed effect. Stop getting fillers in your 20s. And any good dermatologist saying that you need to preemptively get fillers is a bad dermatologist, because my dermatologist told me that I had no, let me take a filter. My dermatologist told me I had no fine lines, no reason to get fillers, because she's good at her job.
That was good. I'm glad that she had a good practitioner. She had a very good practitioner to say, no girl, not now, not now. But yeah, it's gonna do the reverse effect if you do it too young. Now we're gonna go into just some of the side effects or the situation that's going on. And I think what most people are now noticing today and are wondering and really are kind of trying to reverse the, shall I say, damage or the thing that has happened doing filler for so long. Let's just keep watching.
Not many things are like fully reversible that we think that are, and we feel safe as like temporary procedures that people call temporary. Temporary can have a very permanent effect.
Can you give an example of that?
Just overfilled. So you get temporary fillers in the lip, and it sits there for a year overfilled, expands out the tissue. Your tissue will never be the same, even if the filler goes away. So you've expanded it and stretched it out for a year. Now the filler goes away after a year, which it doesn't, it can last 10 years, 20 years, but let's say it does. And that deflational effect is there forever. You've got expanded tissues now. So those are things that people think are temporary, and then it's not.
And does that happen like in the cheeks as well? Anywhere in the face?
The whole face, the whole face. And with all the dissolving, people also have realized two things. One is you got to be really good at dissolving because there's a lot of damage in there, and there's a lot of damage that was done that we didn't realize was being done. So that's another reason to do less filler, more conservative.
The top 3 worst things about filler, I'm going to explain to you right now. Number 1, filler can migrate. What do I mean by that? You inject it in one place, it moves to another. Why? Because it's like a semi-liquid product that gets injected within an anatomic plane. If you put it too close to the edge of the lip, you can get this little mustache of filler above. If you put it in a portion of the lower eye, it can go up into the area above, or it can go lower below. And then you can be looking at filler in places that you don't want it. Number 2, it can create swelling. What do I mean by that? Well, filler injected, once it starts to break down, can block some of the lymphatics in the face. And that can create secondary lymphatic swelling, something called festoons in the cheeks or swelling in the lower eyelid and other areas. It can be made worse by other things happening in your body that contribute to swelling. But the lymphatics are key. That's how we get lymphatic drainage. That's how we maintain the natural flow of blood and other humors in our face to improve the lymphatic swelling. Number 3, late inflammation. Okay, so filler has all these different things that can happen, but this is a very rare thing that can happen, which I'm going to explain to you right now. Fillers, when they are made in a lab with bacteria, okay, and one of the byproducts of the production of the filler is that it has areas that look like areas on bacteria, okay? So there's something called pathogen-associated molecular mimicry, where the filler actually has a part of it that when it's exposed into the body, it looks like a pathogen, it looks like bacteria. If filler is injected into your face and there's bacteria on the surface of your face and gets in there, what can happen is it can activate your immune system, the innate immune system, the early part of the immune system. It can identify that and then create a massive reaction to it. So you can get swelling, redness, something that looks like an infection, but it's not an infection. It's an inflammatory response within your body to what's there, that actual filler. So this process, okay, pathogen-associated molecular mimicry, is really not great. Why? Because what happens after we inject your lips? What happens after we inject your cheeks? What happens after we inject your face? The first thing that happens is you go back to your car, you take out your old lipstick from like 3 weeks ago that's been sitting in the center console, you put it right on your lips, right where the incision was. There's bacteria on your lipstick. Don't put it on. You take your phone, which is dirty as sin, you put that right up against your cheek where we just did the injections. Or you use makeup in your car that's been sitting in your car in the heat. It's probably a bacterial breeding grounds, and you put that on your face. So this is really important. If you've had filler, avoid touching your face. Give that 24 hours or 48 hours to really allow things to be clean. Trust the process. Don't put your phone on your face. Don't put on these lip glosses and things that have been sitting in your car for a week. And that's how you can avoid that late onset inflammatory response. So those are the top 3 problems with filler. Number 1, migration. Number 2, facial swelling from blocking lymphatics. And number 3, pathogen-associated molecular mimicry, PAM for short, an inflammatory response that's dictated by the innate immune system that can create inflammation that looks like an infection.
That was a lot. Yeah, you know what, I never even thought about that, about the whole the idea that the fillers are actually kind of stopping your lymphatic system, which your lymphatic system, in case you're not aware of what that is, it is the fluids that are in your body that help push things through your body, and you need that. It's not the blood system. That has its own pump and that's its own network. But the lymphatic system is actually, essentially, in some cases, it's kind of like your body's disposal. That's where if your body has killed off pathogens or anything, it will kill it or contain it in some way and throw it into your lymphatic system. And your body then kind of cycles it through. So if you are now impeding on that, not only is the filler there, but you can, like you said, you can get this puffy face. And then just on top of that, if you start putting things on your body right in the spot where they inject it, and as we saw, they kind of go really at it, or in the lips and everything. Now you're just putting bacteria into those areas. Now you can be having a response to it, and That's not good at all.
I'm going to show you why you should think twice before letting anyone put filler in your tear trough or under eyes. Unsightly skin color changes. Stubborn puffiness called malar edema that gets worse when you drink a margarita. Inadvertent injections into the eye socket creating huge puffy eye bags. And most commonly, a sneaky little blue-gray puff right where the skin of the face is the thinnest and you can see the filler product. Any and all of these problems can manifest immediately after an injection or even 10 years after just one filler injection anywhere in this area. The lymphatics in that are so vulnerable to damage, and sometimes this puffiness is irreversible. As an injector, it's important to screen patients for allergies, autoimmune problems, fluid retention, weird skin sensitivities. But even when you do and you pick the right patient and the right product, the patient can develop an allergy to this foreign body, sending these patients on their way to deal with all these problems with swelling in the area. Oftentimes, patients do not return to their original injector when they have a complication. I always use an ultrasound to look in this area. It is important to be precise with your dissolving agent and know exactly when you've cleared the area of all the filler. And you cannot do that without an ultrasound or an MRI. Deflating this area of volume is going to unmask a whole world of problems. My favorite treatment for this to replenish volume is a fat transfer. This is your own filler. It has a color match, a texture match. You also do not have an allergic reaction to your own tissue and is rich in stem cells, which can rejuvenate the tissue in the area. And we can also use laser resurfacing to tighten up the damaged skin. Now, I'm not saying it's impossible to get complications from fat transfer, but I am saying if I ever need volume under my eyes, it's going to be a fat transfer from the start.
So that's interesting. I didn't even realize that had that in there. You can do fat transfers instead. So I guess that's another alternative if you really want to do the filler idea approach, because like you said, you shouldn't have an allergic reaction because it's your own fat. So you're just replacing it in other places.
We'll say filler is temporary, or I can reverse them, or I can get rid of them, or they don't last forever. Here's something important to know about filler. I'm a skin cancer and facial reconstructive surgeon, and I spend a lot of time cutting people's faces open, looking at their tissues under the microscope, and I want to show you something very important, what you see here. You see all this grayish blue stuff right here and over here? This is hyaluronic acid filler. This was in my patient's cheek eyelid yesterday. I cut this out while I was doing surgery. Importantly, the last time this person got any filler was more than 5 years ago. Why is this important or relevant? It's because although the clinical effects may be thought to be temporary, the actual residue of the filler is permanent. It stays in the face and intercalates in the tissue for life. So things like duct-filled lips, or filler migration in the face, or the inability to show your emotions properly or smile, making the squinty eyes, for example, are all a consequence. So as a PSA, this stuff is not temporary and can have long-term consequences.
Hi everyone, it's me, Dr. Lal, and look at this. I've got 20 years of filler stuck in my face. Look at that. So here's this woman who actually got an MRI of her face, and the radiologist identified all of these red and orange pockets in her face as filler. Believe it or not, it's actually more filler than she got placed in her face. Why is that? That's because filler attracts water because it's hyaluronic acid based. And she hadn't had filler in around 3 to 4 years, but she has about 20 years of filler in her face still visible on an MRI. What does this tell us? Well, it tells us that filler actually lasts for longer than we think. In addition, filler stimulates collagen and deposits and attracts water in those locations. So while fillers say that they last 1 year, based on studies, they actually last for much longer. So talk to your board-certified dermatologist.
So what you're looking at here is an MRI image of a 33-year-old patient who had over 12 cc, just 12 syringes of hyaluronic acid filler injected to her face over the past 6 years. Now the area that is green is the hyaluronic acid filler. Now what's interesting here is that when we did volumetric analysis, that means when we measured the amount of filler, the amount of volume that was there, it ended up being close to 28 cc, which is more than twice the amount of filler that was injected. And what this shows us is that hyaluronic acid fillers are hydrophilic. That means they love water, and they also cause tissue expansion. So that's important to know. And over the next several videos, I'm going to explain what are the problems associated with these things, how do we treat them. And there is a lot of misconception about dissolving, and we'll address some of those issues and concerns. So please stay tuned and follow for more.
So that is a good part about it. I remember earlier in one of the other videos, they talked about how it would expand, right? But what happens if it were to dissolve a bit? Or like right now, people are trying to dissolve it, as we saw earlier about dissolving some of it. And we'll talk about it more again later in this video. But you've got this expanded tissue now, just your tissue, the skin tissue and everything, just been like, it's kind of like a deflated balloon that's been puffed up for so long, and then you deflate it. It's got like, it's thinner and it's more wrinkly and stuff. I don't know if you've ever seen that, but that's what's going to happen as well if you start using these fillers and stuff. So I just find it kind of interesting. Our next video is going to be talking about kind of like over the time of what happens with fillers in your face and how it looks. So let's just continue.
If you've ever seen people's face look like this, you're probably wondering, how did they get there? Most people don't actually go to their dermatologist or plastic surgeon or injector and ask for this look. People's faces become distorted slowly over time. So a lot of injectors out there say, oh, you need to come in every 6 months or once a year to get your filler touch up. But in reality, filler actually lasts a lot longer than what's on the label. So over time, as you keep getting one syringe here or there, your facial features start to become distorted. And you don't realize it because you get used to what your filler face is looking like. And the reason why this looks so weird is because we continue to chase lines on our face. So it's normal to have hollowing under your eyes, to have nasolabial folds. So when we start to chase those lines is when our face really starts to develop those strange anatomical proportions. Lots of filler is out, natural looks are in.
Very much so.
3 signs someone's had too much filler. Their face looks really puffy and swollen, especially in the cheeks. We call this chipmunk cheeks or pillow face. Overfilled lips start to lose their shape, and we call that sausage lips. When too much filler is done, you can actually look older instead of younger. That's why it's so important to find a really qualified injector.
New trend, celebrities dissolving fillers. But are they really dissolving all their filler and then leaving their face untouched? I'm not so sure. Not only is this trending with celebrities, but there is definitely a significant increase in the amount of corrective work that we're all doing nowadays in our practices. Now, these patients come, they've been injected elsewhere, maybe many places before they arrive, and their treatments are potentially not doing them any favors. It's obvious they've been treated, and aesthetically, their outcome may not be as natural or as pleasing as they were hoping for. Our best option is to remove all of that filler, but then go through a process of slowly refilling with great intention, with a natural aesthetic outcome in mind, and with a strategic, anatomically appropriate plan so that the filler that is replaced will look absolutely undetectable. And honestly, as I look at a lot of these images of celebrities that are getting all their fillers removed, and I see them in their natural state afterwards, I'm very suspicious that they've just been filled better.
Can you imagine, and maybe you're one of them, you know, that you were doing all this filler and everything, and now the trend is, let's dissolve them. Oh, now they figured it out. I don't know, I've always been someone that's like, I will, I'm not interested in injecting things into my skin or my face or my muscle or whatever, unless it's like a medical attention need, but I've never fortunately had to do that. But of course, this is all for beauty's sake. And when we start seeing celebrities, but just people in general, realizing this was such a big mistake, I don't know what I was thinking, why I did it. Some people just go, oh, well, I just overdid it. So, and yes, that is the hardcore truth, is you overdid it and it doesn't dissolve like they said they would. I often wondered that. I'm like, is it really gonna fully dissolve? When I knew about this, we talked about it in school, and in my mind, I was like, I don't know if it's gonna fully really dissolve. I really, I doubt it. So, and here we are. Now the trend is to dissolve it. And you can't just dissolve it. Like the other person said earlier was, it has to be done with, you know, what's the word of it? It's a machine so that you can see, you know, if it is actually all gone. But then you can't just like deflate the skin and then not do anything. So they're having to do a lot of reversing of the damage that's happened, as even another person who said earlier that there is damage there that we don't even know was damaged or was going on and damaging. Now we've damaged a lot of places. So I don't know, if you want to use your face as an experimental tool, be my guest. You can do whatever you want, but just give it a few years and you'll find out what the results are, and you can sit there and go, oh, I'm so glad I wasn't one of those people.
Okay, Ariana Grande came out and said she stopped getting Botox and fillers 5 years ago, and I'm going to tell you why she hasn't really changed looks-wise since she stopped doing those injections. Hi, my name's Maggie. I'm the lead PA at Mahmood Plastic Surgery in Manhattan, founded by Dr. Umbreen Mahmood. And if we look at these pictures of Ariana, we can see that from when she was much younger to up until 2021, she has changed a lot. And we know she had Botox and fillers. But when you look at her pictures from 2018 to 2023, she has maintained really good cheek volume, and she has really nice jawline definition. And really one of the only noticeable things that you can see is that her lips are a little bit smaller in volume. This is because fillers can last much longer than people initially thought. The companies that produce the filler tell us that they last anywhere from 4 months up to 1 to 2 years. I know that this is not exactly true because I do fillers on my patients every day, and once I treat them to full correction, I'm not really seeing that they need to repeat these treatments annually or biannually. It's on a much less frequent basis. Now, when it comes to Botox, Botox is an amazing tool that helps to prevent lines from being set in at rest and prevent any skin changes that result from muscle contraction. So if she started getting Botox at a young age, she's been preventing these skin changes for a while. So if she were to stop even over the course of 5 years, it's not really going to be perceivable on her skin. Finally, Ariana is young and she has access to all of the best skincare and skin treatments. So she can do a lot to maintain her skin without even touching injectables, like doing things like microneedling, lasers, chemical peels, and routine facials. If you are consistent with skincare and you have an anti-aging plan that is focused heavily on maintaining your current skin health, you do not need to lean on injectables as much as you age.
Exactly. Oh, thank you. Thank you. She's saying, understand your skincare and have a good skincare regimen. That's what I've been saying. Let's listen to more people who regret what they did.
So my biggest regret in my early 30s was doing tear trough filler. And I'm gonna walk you through exactly what happened, how I undid it, and why I have no plans on ever putting tear trough filler in my face ever again. Let's talk about it. So this is me putting filler into my tear troughs. The very first time I did it was the day I turned 33. And let me tell you, the first time I did it, it was as if like a magician came into the room and just wiped my dark circles away. It was magical, unbelievable. So I kept doing it and doing it and doing it. And by overcorrecting and having so much product there, in and around the eyes, the product started to move because those muscles are used so much. Think about how many times you blink in a minute. It looked unnatural, blue, and puffy. So this is how I fixed it. When filler migrates, it won't metabolize. It won't go away on its own. So you have to use radiofrequency energy to make it go away. So via ultherapy, or here radiofrequency with microneedling, finally it went, and my under eyes have never looked better.
So if you're thinking about getting lip fillers, just please don't. I know it looks good on some people, and I'm not a doctor, but in 2019, I did a Juvederm campaign. Like, I was a model in the Juvederm campaign, so I had to get filler in my upper lip. Naturally, bottom lip is big. It just looked like this already. The upper lip was like a little bit thinner. It's been 5 years, and I've gotten it dissolved once already, and it's still not gone, and it's causing this insane bubble. Let me show you. When I smile, what's that? What is that thing? I spent my own money to get it dissolved, by the way. And I'm pretty sure I signed my rights away, so I can't even like do anything about it, especially not 5 years after the fact. But anyway, just don't get your lips done if you didn't really need that. My lips hardly even look different before and after the filler. Now I have a bubble in my lip like permanently because if dissolving it once didn't work, I think I'm just stuck like this now. Anyway, yeah, I really regret it.
Okay, watch me ruin my beauty with filler. This is what I started off at 21 years old. Never did anything to my face. First syringe of filler of my lips, Second syringe of filler in my lips. Cheek filler, jawline filler. Chin filler, more cheek filler, more lip filler. Okay, so now I look like a human blow-up doll. I can't even tell you how I thought this looked good. Hold on. Completely different face. Here is my Simpson lip from the side. And I was working at very prestigious medical spas at this time. Like, nobody said anything. Like, this was like a normal look. This is one of the worst photos I have of myself because I didn't take it. There's no filter. The lighting is not good. And I look absolutely insane. I know how dysmorphic filler can be. This happened over a period of like 5 years or so. So this is me this past summer. It's been a work in progress getting back to my old self, but I can't be more happy. I feel like I look like I'm back in my 20s again. I feel like I look like myself. So if you guys are interested in knowing what I've done, I don't know if you want to know, let me know in the comments and like and follow for more.
There's 2 injectables that I would never, ever get done again. Number 1, tear trough filler. I had my tear troughs done last year and I ended up with this like puffy under eye area. I didn't do my research and I got an injector who was not very experienced and I ended up having to go get it dissolved. But the problem is when you get it dissolved is that they're using hyaluronidase to dissolve the hyaluronic acid. But it's not specific to just the filler. It will dissolve your own hyaluronic acid and give you a more sunken in look. So until I was able to replenish my own hyaluronic acid, which I think took like almost a full year, I basically had more sunken in area and darker circles than I had when I started. And when I switched injectors and told her about what had happened, she said that there's other procedures that you can have done that are way lower risk and that you should only get your tear troughs done as an absolute last resort. She recommended getting cheek filler done to help lift that area or doing laser treatments like CO2 or microneedling, but basically had said that any good injector knows that the tear troughs are incredibly hard to treat and should just be a last resort. I'm out of time, so come back for the second thing that I would never, ever get done again.
Get ready with me whilst I tell you what the hell I did to my face to make it look like that when I was 26. I think I was around 26 at this point. Maybe I was 27, and this was when it was like peak filler era. It was like Molly May with all the bad filler. It was Kylie Jenner with all the filler. I know she like still has a ton of filler, but we know that she's probably got slightly better work done now after having it dissolved. And this is what I did to myself. I ended up looking like this guy. Yeah, him. Prince Charming from Shrek. Truly is uncanny. What I had done in this particular time of my life, I was having filler in my chin. I don't know why. I had lip filler, which I still have now, but I got these dissolved and had these redone. And I had cheek filler, which you can't really see because of my sunglasses, but I'm telling you, my cheeks started to look like chipmunky cheeks. It wasn't good. I had jaw filler. I had filler like all here. I had filler here. Where else? I had filler in my under eyes. I also had filler in my nose because this is when back before I had my nose job, and I had a non-surgical rhinoplasty. So I had a lot of filler in my face. I think you can just really tell. It's not necessarily like bad practitioners. It's just me being an idiot, being like, I want to get all this stuff done to my face and to try and like just the more filler, the less insecurities. Surely. One of the most scary and challenging things about getting subtle, tweaky bits of work done, it's very easy, it's accessible, and it's actually quite addictive. So there's a lot of people waiting to capitalize on people's insecurities and their bank cards and credit cards, essentially. I'm not saying everyone, but I'm saying there is a lot of people out there. I know that I went to get my lips done, and the person who did them at the time, I said, how much more could I get away with having in? And she said, you could get a whole meal. I did not need my lips redoing. I did not need them doing again. I needed to be told to leave. It's why I always go to practitioners now who tell me no. So when I got my cheeks dissolved, I went to Dr. Esho, and the whole plan was to go back and get them refilled. So I went back 2 weeks later after having the high lays, and I was just like, cool, here to get my cheeks refilled. And he looked and was just like, Sophie, you've got really good cheeks. You don't need you don't need cheek filler. He was like, your cheekbones are great. You don't need it. And I was like, yeah. You're actually actually right. And I just left, and it was really good, because having something like that is really, really, really important. So someone who can say no, great. If someone is going to say yes to everything, and you know deep down when someone is saying yes to stuff they shouldn't be saying yes to just to make money off you. But yeah, that's my life lesson. And don't be afraid to go get things dissolved. Having my filler dissolved, best decision ever.
If you've ever had filler, beware. My lips look like a botched filler job. So I got lip filler 4 months ago just as like a practice for our resident cosmetic clinic and just to experience what it was like. Lip filler usually like goes away in about 3 or 4 months just because we use our lips a lot. This is 4 months out and this started like 3 days ago. Viruses and COVID included can trigger reactions to old filler. Basically what's happening is my immune system is trying to fight something, reacting to something, and it's attacking the filler or antigens. Based on case reports, I tried lisinopril, just started prednisone. I'm considering just melting the filler, even though it's not really the filler doing it. Just something to keep in mind if you get sick a lot and you are considering getting filler. Also to not freak out if you had filler and this is happening to you. It typically goes away in a few days, but in the mornings, it is so painful to move my mouth.
I really contemplated making this video because my healing is not finished. But if you're trying to get lip filler, don't do it. I literally want to cry. I hate this. Please do not touch y'all's face. Do not. You are perfectly fine the way you are. I promise you're going to regret it. I don't know what I'm more mad about. The fact that I wasted my money, or the fact that my lips are botched, and I don't know which one's pissing me off more right now. Like, don't do it. Look at how the bottom lip is just nice and even and smooth. Look at this. Lumpy as let me tell you something. Body dysmorphia is a real thing, and like most people, I definitely had insecurities. There were things that I used to nitpick about myself, but I'm not even gonna hold you. This experience has made me realize that, you know what? I don't wanna touch else.
PSA to all my little girlies out there that are thinking about getting lip fillers. Let me be the first one to tell you. First of all, it's not in trend anymore. Second of all, you're going to end up regretting it, and you're going to one day want to dissolve your lips like I just did, and it's going to hurt like a bitch. And you're not going to be ready for it, and you're going to literally look like Donald Duck. Don't get lip fillers. Forget it. Let go. Your natural lips are beautiful. Shut up.
So I think that's really interesting. And I remember someone saying that they think that the new trend is to look more natural. And I think the only reason why we've come to that section of the trend being more natural is because people have done so much to themselves that they've had to accept it now because they're reducing everything that they've done so much over the years. Now they're regretting it to such an extent. And so now it's like, oh, well, that's the new thing, is to be natural now. It's like whatever trend we were using to do something, we then come back a few years later and go, oh, we're going back to where we were. Why was that ever a trend in the first place? And as one girl said, she says it is a dysmorphia situation, but it's also over an insecurity. You're insecure about yourself. And when you're insecure, you're going to spend a lot of money. You're going to do a lot of things and probably make a lot of regrets. And so I agree with her 100%. A lot of these people are like, well, what was I doing? What am I doing? And now they're realizing, like, you know, there were too many yes people in my life. I wanted to do X, Y, and Z. And they're like, yeah. And then finally someone just said, no, you're actually very beautiful naturally the way you are or were or whatever it was. You don't need anymore. And she's even completely agreed. I know I'm going back a few videos earlier, but because I'm just trying to go through all of these. This is a long video. I'm a little exhausted myself actually right now, but we're almost done. Let's go take a look some more at what's going on. Oh, and this one's actually really important. I remember this one. This can happen. I don't think it's very common at all. Otherwise, I don't think many people would be doing fillers or any of this, but this is kind of important.
Because I didn't know that, and now I am dealing with.
Even though this is rare, delayed onset nodules are something that can happen with fillers years afterwards, and it's much more common with a particular type of filler. And while we're still trying to figure out what exactly it's caused by, it's a mix usually of the filler being redistributed or your inflammatory reaction from, say, a vaccine or from getting a cold or the flu, but it almost always has to do with a biofilm or a collection of bacteria around that filler. The good thing is that they usually resolve on their own, or they can be injected with steroid, or you can take a steroid by mouth. Sometimes they are dissolved also. This is why I always stress, when you are getting something like filler or laser, these are medical procedures. And you are not paying for the product, you're paying for the procedure. You're paying for the expertise of somebody who knows how to do this, recognizes the complications, and knows how to manage those complications. So if you're getting filler at one place and it's $500 and then you decide to go to someone that's $100, there's probably a reason why it's that much cheaper.
Now this one was actually, I had to take it down, like the volume, because copyright, but she's saying that if you get this, you should go to medical. That right there was a medical response. You need to go to the hospital immediately if you start seeing this. And so this girl's gonna kind of show you what happened with her too. And I don't think the volume's very high because she was using music. So I kind of had to do a few things, but I wanted you to just see it.
Y'all, so I went and got lip fillers, needleless lip fillers, and things went extremely wrong really, really fast. I had a reaction. This is immediately after. They're about to get worse by the second. Look at this, y'all. This was me going to the car from leaving inside. Every second they was going up and up, and this is not even the worst that they got, y'all. I don't think y'all ready for what y'all about to see. How me going to go get lip fillers ended up to me in urgent care. I don't know what happened. Like, it got worse, but I think it's about to get worse. And here I am walking into urgent care. Y'all got to tune in for part 2. I'm going to tell y'all how I ended up here, what happened, and what the doctors had to do, and how I look today. They are bruised, black and purple. Catch y'all part 2. Okay, y'all, so this is part 2. As y'all see, they got progressively worse. I did end up going to the ER. They gave me a steroid shot, and they also gave me prednisone that I have to take for 6 days. They all were shocked when I came in. I had my hand over my mouth. I moved my hand, and they just sent me straight to the back without getting my name or anything. It was like that bad. This is fucked up. You look like an episode of Botched for real. Y'all. Here are some still shots of how bad it got. My kids will not let me live this down. My lips are somewhat back to normal. They bruised really bad. It did not hurt at all, guys. Like, I was in no type of pain. It was kind of funny to me, but I'm okay. Everything's back to normal. Still can't believe it.
Please watch this one, and these are the dangers of dermal fillers. I love dermal fillers. I inject them. Here's the precautionary tale of a woman whose nose, as she says, melts off after filler injection. She's 52, her husband is 10 years younger and got mistaken as her son on a couple of occasions, and she's been getting fillers over time. However, in the year 2000, she had a filler injection, her nose felt numb, and she had an occlusion. The filler goes into, around, or causes spasm of the vessel, and you get death of tissue. Now, someone commented here on my other channel, in fact, I think it was an injector, said, well, it's just an occlusion, no big deal. Well, it's a huge deal. You need time-sensitive intervention, and you need the right products to dissolve. Sometimes you need an ultrasound to locate it properly. Some people getting fake fillers are getting permanent ones that cannot be dissolved, and you cannot reverse these. See an expert, you get what you pay for. Filler injections are a big deal.
Yeah, that's, I forgot about that. That I remember hearing a few years back that sometimes some fillers are permanent fillers. I don't know what they're made of. I don't know what the consistency of it is, but they make them that way so that they don't disappear, so that you don't have to keep getting these things over. But that again is probably a bigger no-no and a bigger problem than ones that are supposed to dissolve. And like one girl said, even when you go and get your own, it dissolves when you're trying to dissolve it. It will dissolve your own as well. So then you got to kind of plump up and get your own hyaluronic acid or whatever back up to normal too. So I forgot about that. And I remember reading or hearing a story about a woman who went and got some kind of filler, and she was later told that they put in a permanent filler. They never told her that it wasn't supposed to be dissolved. And, you know, I think that was her first time doing it too, so she wouldn't even know if she liked it or not, let alone just going in for a permanent thing. If you hit a vein, or any other weird spot besides where you're supposed to be putting in the filler, you can get death of tissue. You are killing your skin. You are killing everything. And I don't, oh, it's so sad. So I just, you know, I'm all about skincare. I'm all about properly taking care of yourself. As you know, you've probably already determined that I am kind of anti-filler, anti-Botox. If you want to do it, that is fine. You can do whatever you want with yourself. I'm just making a video because I wanted to kind of just express and explain what are the consequences, what are the possibilities. Some possibilities are great looking. You know, we saw some really good ones. That's why I put those in there. I don't want you to think that it's all about the bad. There are some really good ones. But it's bad enough that we kind of have to sometimes feel like we need to use just even a little bit of makeup to make ourselves feel better, to look better, let alone now doing any kind of procedure or plastic surgery or just a simple, invasive procedure such as filler and Botox. And my whole channel is about having you understand more about yourself, what you can do to balance out your features naturally in a way with beauty, colors, and just knowing yourself in general, enough to know exactly, hey, you are beautiful, you just need to work with what you have, and this is how we do that. And you can be really happy with who you really are naturally without having to rely on expensive procedures. Some people would say that they don't think that Botox or fillers are that expensive because they have the income for that kind of thing. But for, I think, a lot of people, especially in today's time where we're hearing about a lot of people having problems with being able to just pay for the basics in life, filler and Botox is really far away in the distance as far as being able to really afford it. And I think a lot of these people, the people that we've ever seen, I don't think a lot of them have ever really been able to afford these processes. I think a lot of people were using credit and debt in order to pay for these procedures, and now they're going to have to use even more money to reverse any of the damage that they don't like. I know that some people are still doing it. It's fine. But I feel like it is now the thing that a lot of these people who had been doing it for many years are reversing it, as we've seen. And it is now kind of like, I think, a trend. Not to be a trend to be trendy, but it's a trend because it's what a lot of people are doing. It's not because it was something that they ever wanted to see themselves doing, but that they're having to because they don't like the results that they had done to themselves over the years. So, now I'm not trying to give anybody shame or blame or whatever if you have done fillers or even Botox, or if you don't like it anymore and you're doing the reversal or whatever it is. I'm not trying to blame it. I'm just trying to put information out for you. So in case you're someone who has thought about doing fillers, this is just some of the possibilities of what might be happening and what can happen. And sometimes, like one lady said, they don't go in there to finally look like this. It happens over time because we get used to our filler face, and then because they're chasing a line, trying to get rid of, oh, I don't want a wrinkle, I don't want a line, I don't want this, they start doing things to themselves over and over, and they start putting it so much that their face starts to become distorted, and now they're all reversing it. So if you are someone who uses filler and maybe you still love it, it's great, put it down in the comment box below. I'm curious to know what you're using it for, if you still like it. If you're someone who's reversing it, you realize the damage or whatever's going on, you've done too much, let me know that too. And if you're someone who is thinking about it, let me know what you think about this video for sure, to tell me, is there anything that has made you think in a different way that you never thought before? And now you're happy to hear this because now it's making you second guess if you really want to do it. So before we leave here, I just want to leave something that I think was kind of funny, because I feel like this is what happens in a lot of offices. And the people that work there, you know, they don't see what they're doing or what's happening necessarily because they're all doing the filler and the Botox because that's just what they do. And a lot of them are working in these places because that's what they want, and they get either a big discount. I don't think they get it for free necessarily, but I'd say at least a good, nice discount. And that, yes, they're not all of them, thank goodness, but I think a lot of them can be very yes people. So they just keep going and going. So I just thought this would be funny. This is for laughs and giggles. So let's just watch.
Hi. Hi, thank you so much for coming, and we're so excited that you're Your face is so beautiful. I can't wait to have it look just like mine. You know what? Keep my deposit. I'll see you never. Have a great day.
Exactly. So we've kind of seen what happens, and like she said, like, oh, you have such a beautiful face. I can't wait to make it look like mine. I just thought that was the most funny thing. So anyways, thank you again for joining me here at Contour Image, and just remember to stay beautiful for life.